It's a cold day in London, and I plan to warm it up with an interview to innovation expert Daniel from the National Health Service NHS UK. I am GIMI Tsuboyama, the Innovation Ambassador for the Global Innovation Management Institute, and I will bring this innovation series to you. Let's meet Daniel. And here we are with Daniel Jeffery, the Head of Innovation and Delivery at NHS National Health Service Digital UK. We will grasp all his knowledge and expertise on this area, and he will take us navigating into what is his day-to-day role and position at NHS. So Daniel, please, can you tell us more about you?
More about me, about my role, my day-to-day role. So head of innovation and delivery at NHS Digital, specifically within a department called the Data Security Centre. This is ultimately where the security operations for the NHS kind of takes place. That's both in terms of monitoring and threat intelligence and advisory and guidance, all the way through to coming up with new novel ideas about how we can enhance our existing services, but also deliver new services out to the system. But also we look at how we can improve or innovate on existing technologies to make them more secure, but at the same time make them more fit for purpose for the business.
That's what we call innovation with purpose, right?
Yes, yes.
And so now is the moment to show that pride. Which are the innovation stories or innovation success cases that you have within NHS?
So one that kind of springs to mind, because it's pretty much hot off the press, as they say, is we innovated around a process called joiners, movers, leavers. It has a fundamental transformative effect on security across the email estate, but also the experience of onboarding new medical staff into trusts. So the problem statement was this: it will take anywhere between 5 and 15 working days for an identity to be provisioned. Security problem with this is, one, there is a lag time between registering and then being authenticated, allowed to do stuff, but also that's joiners. When people leave, closing down accounts, closing down access, didn't happen in a rigorous manner. Therefore, you had a whole bunch of what we call dormant or orphaned accounts, which means that they are subject to being hijacked, identity theft, etc. All the things you read about in the news and stuff. So what we did was fairly simple. We automated the joiners, movers, leavers process. We found an existing technology using staff records and the national email service. We automated the process.
I really like the case you have mentioned, and I think it has a lot of impact, not only saving, in terms of saving money, but also in terms of giving more security and giving a more access and a speedy solution to that, right?
Yeah, yeah.
That's good. And so, in those lines, which challenges have you faced maybe with that project or maybe other projects within NHS that maybe is not so successful, but maybe we all can learn about some of the things that you may have to say on that?
So, one thing with the NHS obviously is massive. Yep. Things that we've learned of challenges we've encountered. So, we do not have a mandate, right? So things we deliver, we cannot enforce onto our customer base, right?
Yeah.
We're not like the military, where if the Security Operations Centre in the Ministry of Defence says we want to do this thing for security, it just happens, right? Everyone has to do it. We can't do that. We basically have to sell a free thing to our customers, which are trusts and hospitals and ambulances. It's a bizarre thing, but it's also necessary because it actually gives us good feedback about why they wouldn't necessarily adopt things even though they're free, because they don't quite meet their business needs. It means that we are laser focused about ensuring the business need, the business benefit. So we take that joiners, movers, leavers process beforehand. When we've actually gone out and kind of spoken to trust about it, would you like to use this thing, it's free. We've never really sold it on a security credential. It's always been on a, we'll save you time, we'll save you money, we'll get your doctors through the door quicker. Security is somewhere down the line, right?
Yeah.
But that's how, so the challenge there is making sure, convincing them that it's the right thing to do. Another challenge being NHS being the NHS is it's obviously, again, a huge organisation, an old organisation that has everything from legacy equipment bought in the mid to late 90s. Our challenge is, as a programme, to secure that spectrum of technological capability and help them be networked together in ways in which they were never designed to do or to be, whilst also ensuring that the confidentiality, integrity and availability of data is not compromised in any way, shape or form. So we are currently spinning up an innovation factory or innovation hub. We don't have all the money in the world. We have to focus our time, effort and treasure on those things which will have the greatest impact within the financial confines that we operate in.
So you have mentioned some of the process that maybe you are following, right?
Mm-hmm.
So please can you navigate us more in detail about how to make those innovations real, how to make them happen?
Mm-hmm.
Do you have a process or?
Yeah, well, I'd say we're standing up the factory, so we've got a couple of what we call pipe cleaners where we'll be testing the process end to end. So there's a couple of what we call no-brainers we just are going to be putting through this innovation factory. The way in which it will work is we want to have a multitude of sources of ideas, yeah,
Okay.
to come into the factory. So that could be problems from the ground, you know, clinicians and what have you. Security problems identified by security specialists around the system. There's like a ideation box or whatever. They come up with ideas. They talk about common problems, common themes. Put those forward. We kind of challenge backwards and forwards, and then we kind of take those through to the first stage of ideation, where we start really qualifying kind of very high level, light touch prototypes, all the way through that whole kind of MVP, iterative agile process. And then once fully qualified, once you're in that MVP kind of beta stage, make a decision about whether or not to actually fully deploy or not. And then you hands over into the delivery side of things. So we have a innovation and delivery. Innovation is all about kind of succeeding fast or failing quickly. And then once justified, once understood, then it's a handover into delivery with all the appropriate governance and wrappers.
And so in that process that you are mentioning, the idea, the suggestion box that you mentioned, are those just ideas that pop up from whoever in the network that you mentioned, the architects, or is that you have somebody that, for example, the strategy team saying like, we have this challenge, we need to address them. So here's
so that's one channel, that kind of bottom up channel from the Cyber Associates Network is one channel into the box.
Okay.
There's also where is the NHS going, and what are the problems that strategic one. So it's a top-down approach as well.
So you will receive from both.
From both, yeah.
And within your team, how do you prepare your team to manage innovation?
So in terms of, so we have a dedicated innovation team.
Okay.
Yeah, so we have an innovation lead, we've got a data architect, security architect, etc., who kind of run the process, run the function. But everybody in our department, from on my side of the house, can bring ideas, sponsor ideas, champion ideas, to push it through the system, and or push it through the process, and then champion that into delivery.
Those were 3 really key tips or key takeaways from Daniel Jeffery, Head of Innovation and Delivery at NHS Digital. Really, it was very, very, very good to meet you and to have or grasp all those insights from you, Daniel.
Pleasure.
And I think I quite agree also with all of them. We may have more talk afterwards. And I invite you to stay connected with GIMI Innovation Series for the next chapter. Thank you.
Thank you.